السلام عليكم ورحمة الله وبركاته. معكم رحاب أبو عثمان من تخصص العلوم الطبية المخبرية، وموضوعي بيتكلم عن الفيكال microbiota transplantation. And first of all, I'm going to give you a brief introduction. As we all know, human body consists of organs, tissues, and of course microbiota. And here we are talking about gut microbiota, which inhibit the gastrointestinal tract and create a complicated ecosystem. This ecosystem is dominated by bacteria due to their large amount, and this bacterial diversity impacts many factors in the organisms. So it is believed that each individual has a unique microbiome. This microbiota has a relationship with their host, of course. Some are harmless and some has mutualistic relationship, and all lives in harmony. But if this equilibrium has been disturbed, which is known as gut dysbiosis, some pathological conditions could develop in the nervous, respiratory, and gastrointestinal systems. But what factors could likely disturb this equilibrium? As we know, antibiotics save lives, but they have a negative effect because they kill beneficial microflora in the organisms and cause resistance of harmful bacteria, so we are considering antibiotics as the main cause of gut dysbiosis. As I said, if gut dysbiosis occurs, pathogenic bacteria will override, especially Clostridium difficile. Why Clostridium difficile? Because this bacteria found in the digestive system of 1 of every 30 healthy adults and can easily survive on hands, surfaces, and objects. It's a bacteria that causes life-threatening diarrhea, which is usually a side effect of taking antibiotics, which will result in gut dysbiosis. Clostridium difficile infection mostly occur in people 65 years old and older and who are taking antibiotics and receive medical care, and people with weakened immune system or previous infection with Clostridium difficile. But how this began? The scenario begins when the patient starts taking antibiotics that work against several types of bacteria, which is called broad-spectrum antibiotics, or several different antibiotics at the same time. Here, as we see in the first picture, there is a Clostridium difficile toxin B and Clostridium difficile gram-stained, and of course Clostridium difficile under microscope. Unfortunately, these antibiotics disturb the balance of bacteria in the bowel, which can cause the Clostridium difficile to multiply and produce toxins. These toxins will make the person ill and cause severe diarrhea. When this happens, Clostridium difficile can spread easily to other people because once it is out of the body, the bacteria turn into resistant cell called spores and transfer to another people. Since we understand the problem, there must be a popular methods for manipulating this intestinal microbiota. Mainly, there are two ways, which are antibiotics and probiotic therapy. A recent study published in 2013 in the New England Journal of Medicine showed that probiotics is more effective than oral vancomycin. So, probiotics are safe to consume because they are live microorganisms promoted with claims that they provide health benefits when consumed for improving and restoring the gut flora. And this is what we call fecal microbiota transplantation, or FMT. Then probiotics is demonstrated by FMT. To know more about FMT, look at the picture below, which emphasizes the procedure. Here we have a donor feces, which will be mixing with a diluent, could be normal saline, then blending and filtered. Then it is transferred to the recipient by endoscopy or by oral capsules. Donors cannot be anyone. There is a strict criteria, such as that the donor should not be immunocompromised and should not have recently traveled to endemic area, should not have any history of incarceration, and should not have any antibiotic or tattoo exposure in the past 6 months. Of course, they should not have any history of drug use. Not just that, lab tests must be done, such a blood test to detect hepatitis A and B and C viruses, serologies to detect HIV, RBR, and also stool tests to detect ova and parasite and giardian antigens. Obviously, not only the donor has criteria, all the recipient must be prepared, and this contain following a bowel preparation instruction closely, also drinking plenty of clear liquids, Make sure your doctor is familiar with your medical history. Of course, the recipient should avoid any drinks with purple or red dyes, complete all steps of preparation, and maybe warm before the procedure. After the donor and recipient has been chosen, FMT will take place, and this can be administered orally, nasally, or rectally. For the best way of FMT, it is considered the rectal way by colonoscopy. Why? Because there is no risk of quick fecal material removal. And administration of fecal microbiota in oral capsules has also been reported, so no worries. But by contrast, if the procedure done by nasoduodenal tube, which I mean by a tube enters from the nose until reaching the intestine, this will cause a complications due to the large quantity of pathogenic bacteria in the upper part, eventually causing a pulmonary infection and also gastrointestinal complications. Now for FMT protocol for preparation of fecal material. The preparation starts with 200 to 300 milliliter of diluent, which will be water, saline, or milk, plus 50 to 60 gram of stool. These will be homogenized into a liquid suspension. The mixture allowed to settle for 5 minutes and then filtered first by the gauge and through the syringe. It is good to notice that FMT has been performed in animals as described in humans, and filtrate obtained in the syringe can be used immediately or refrigerated or could be frozen. Also, fecal material obtained from donor can be frozen at -80 Celsius with the addition of glycerine thawed without loss of efficiency. This allows a long-term storage. The doses vary from method to another. This is why 250 to 500 milliliter of suspension are used for rectal administration and 50 to 75 milliliter when added through the upper gastric section. FMT protocol giving precisely 50 gram, because giving less than 50 gram of stool, the use of feces less than 50 gram increase the frequency of recurrence by 4 times, so the protocol is strict. The main result here is that FMT represents a novel therapeutic strategy for Clostridium difficile infection and gives a positive influence on other GI tract diseases. But more research studies are still needed to determine if FMT should be performed for other clinical indications. Now there is some points that must be discussed. FMT was believed that it is more effective if the stool was taken from relatives, but another reports and studies has disproven this, showing that fecal material taken from non-relative has the same efficiency. The age of donor can vary from 18 to 70 years old, and several new scientific reports underlined that gender must be accounted because males and females utilize the same microbiota differently. FMT has several side effects such as any procedure. Some are natural response of the body to a new organism such as abdominal discomfort and constipation, and this doesn't pose a bigger threat. But there is inappropriate donor screening and incorrect analysis of fecal donor material may lead to contamination of patient by pathogenic microorganisms and will lead also to serious adverse effect of FMT. But once there were a disastrous side effect, which is that one person has died after receiving a fecal transplant containing drug-resistant bacteria. The donor stool was not tested for drug-resistant bacteria, which is the extended spectrum beta-lactamase producing E. coli prior to the transplantation. Then, after the death occurred, stored preparation of the donor stool was tested and found to be positive for the identical strain of bacteria that is found in the donor. In my opinion, now the biggest challenge for doctors and scientists is to develop appropriate procedure for selecting donors and discovering new techniques that will allow for precise examination of donors' materials. Also, the FDA must be warning healthcare providers that the use of FMT or fecal microbiota transplantation can lead to a serious or life-threatening infections. Thank you deeply for watching. Thank you kindly for watching, and I deeply appreciate your time. These are the references, and thank you again for watching.